Happy Wednesday, everybody. Wanted to touch base this Easter week and wish everyone happy Easter, Passover, whatever you celebrate. I hope you all are enjoying perhaps some downtime and time with family. This week I wanted to just touch base on a supplement that we are very high on here as far as particularly bone health and teeth health, and that is vitamin K2. But I wanted to touch a little bit on the history of it and what else it might be good for so that you understand the importance of it. We know that as early as the 1600s, there were Japanese samurai soldiers who were eating this soybean fermented product called natto. And it's this just really gooey, gummy, stringy type product, but is very enriched with vitamin K2. We know that back in the 1930s, researchers were looking at chickens that were being fed a very low-fat diet and realizing they were bleeding. And so when they replaced the fat in their diet, it would stop the bleeding. And so ultimately they were able to isolate the structure in that fat that was helping with this problem, and it happened to be vitamin K2. This was actually awarded Nobel Prize in 1943 for the two researchers that not only discovered it, but then they were able to isolate this particular vitamin. And there was a compilation of vitamin K molecules, but ultimately we're able to distinguish between vitamin K1, which was markedly involved in the clotting system in the body, and then vitamin K2, which has more power and more strength in helping with bone health, but there are a lot of other things that vitamin K2 does. So what we discovered was that this family of vitamins really had to do with coagulation in the body and supporting the bone health. In the 1950s, a researcher, a dentist, a Canadian dentist who traveled the world and were looking at teeth production and around the world, discovered that there was this special activator, which he called Activator X, that was a missing ingredient for much of tooth and bone health. And this happened to be vitamin K2. And this was ultimately approved as a drug in Japan in the 1960s. Back in the 1970s, they continued with research and understood that this vitamin was essential, being passed from mother to baby, and if there was not adequate amounts of it, they would give vitamin K2 as soon as infants were born. And then began to look at the bone health markers and understanding what K2 does as far as a hormone in the body called osteoclastin that is important for bone health. And then back in 2015, they began to look at the importance of this vitamin and its what it can do for cardiovascular health in preventing calcification or pulling calcium out of blood vessels to reduce the risk for cardiovascular disease. So we've kind of really continued in this process of learning what can vitamin K2 do, and now we are understanding there's even more benefits in what it does in terms of skin health. We know that with skin health now, there is less calcium deposition in the soft tissues and therefore improves elastin in the skin, which lessens wrinkles. So there are so many things in different areas that vitamin K2 is beneficial for. We know it's bone health, we know that it's beneficial for dental health, cardiovascular health, but also for children as they're growing. Vitamin K2 is quite valuable in terms of bone health and increasing osteocalcin that is important for the quality of bone production. We know that it also helps with blood sugar control in that this osteoclastin that is released into the bloodstream helps production of insulin, but also increases insulin sensitivity and glucose metabolism. So this is quite important. It can reduce inflammation. It can improve athletic performance. It can help with male fertility. It also is important for kidney health, brain health, prostate health, and then, of course, as I mentioned, skin health. So this particular vitamin is quite vital, and that's why we put it with our vitamin D. It is a fat-soluble vitamin. The 3 fat-soluble vitamins that we know of are A, D, and K, and these are important vitamins, and it's nice to get them all together. So doses, if you're not getting any vitamin K2 with your D3, would encourage you to pick up either a combination or get some vitamin K2 and take anywhere from, say, 45 to 100 micrograms of vitamin K2. Quite beneficial, as you can see, for a number of areas in the body to bring health and wellness. So hope that's helped a little bit, get a little bit of history of vitamin K2 and the areas where it can be most valuable. As I just tell my patients, we just know that it keeps calcium in bone and teeth rather than in your organs or in your vessels. And now that we're seeing some valuable research in skin health, we see that it's keeping it out of soft tissues and therefore helping with reducing wrinkles, particularly in the face. And of course, part of our work here in our office is helping with aging skin and aging everything. So I think that hopefully that's given you some insight and some valuable information, and that you will make sure that when you're taking your supplements and getting your vitamin D up, which I hope most of you are still continuing to do as we continue to walk through this time period of the pandemic, that you would just make sure that there's some K2 in there. Wish you all a great weekend. Hope you have wonderful holiday celebrating with family, and we will talk again next week.